So imagine discovering that the key to reversing one of the most debilitating but honestly rarely discussed signs of aging comes from the DNA of trout.
I mean, it sounds completely absurd at first, right?
It really does. But we are looking at tissue degradation in the most intimate part of a woman's body. And this is a physiological reality that affects, well, millions of women.
Oh, absolutely, millions. And it's a reality that's traditionally been shrouded in this sort of, silence and embarrassment.
Yeah, and a distinct lack of open medical dialogue, honestly.
Yeah.
But today, the science of regenerative medicine is really just blowing the doors off that taboo.
It's the absolute definition of a medical blind spot, honestly, because for decades, the options provided to patients dealing with intimate aging have been frustratingly limited.
Totally.
But we are finally seeing this fundamental shift in how we approach women's intimate health and specifically structural tissue repair.
Right, and we have a really fascinating stack of sources for you on this deep dive. So we're looking at clinical studies, specifically the Palmieri cohort study out of Italy.
Yes, that's a great one.
Yeah, and we've also got aesthetic clinic protocols for combination products, like Nugen. Plus, we were reviewing safety guidelines from the UK's National Institute for Health and Care Excellence, or NICE.
Right, and we're also analyzing those government regulatory consultations from the Joint Council for Cosmetic Practitioners.
Exactly, because our mission here is to strip away that taboo surrounding intimate aging. We want to objectively look at the science behind a rapidly growing, non-surgical, non-hormonal treatment.
A treatment that relies on, of all things, highly purified fish DNA to rejuvenate the vulvovaginal area.
Okay, let's unpack this because, we can't really dive into the solution without establishing the biological root of the problem first, right?
No, you absolutely have to start with the biology. So the medical community refers to this overarching condition as genitourinary syndrome of menopause, or GSM.
Right.
And we're going to put a specific focus today on vulvovaginal atrophy, which you'll often hear abbreviated as VVA.
So the female genital tract is incredibly rich in estrogen receptors, right? Like during a woman's reproductive years, estradiol acts as this primary chemical messenger.
Exactly. It's the signal that keeps that tissue thick, elastic, and, really well supplied with blood flow.
And to put some actual numbers on it for you, normal estradiol levels fluctuate pretty wildly with the menstrual cycle. They can soar anywhere from 30 up to like 400 picograms per milliliter.
Right, so the tissue just thrives in that high estrogen environment. It's constantly being maintained.
But then menopause hits.
Yeah.
And that baseline just completely falls off a cliff.
It really does.
The sources note that postmenopausal estrogen concentrations drop steadily below 30 picograms per milliliter, and they just stay there.
Yeah, and that is a massive biological shock to tissue that relies on that specific hormone to maintain its basic structural integrity.
So what exactly happens to the tissue when that signal goes away?
Well, without that constant maintenance signal, you get this devastating cascade of physical changes. The vaginal mucosa undergoes progressive thinning and drying.
Wow, okay.
Yeah, and you see a smoothing out of the vaginal rugae. Those are those internal folds of tissue that normally allow the vagina to expand and contract.
Right, so it's losing its flexibility.
Exactly. The entire area just loses its elasticity and pliability.
And externally, like on the vulva itself, the sources highlight a really significant loss of adiposity.
Yes, the fat loss is a huge factor.
Right, the fat pads in the labia majora diminish, which means the outer lips lose their volume and their structure.
And reading through these clinical descriptions, it becomes clear that this is not just an aesthetic shift. This degradation severely impacts a woman's quality of life.
Oh, severely. The clinical symptoms include chronic itching, severe irritation, recurrent urinary tract infection.
That's baryunia.
Right, which is the medical term for painful intercourse.
And the daily discomfort can just be debilitating. And historically, the standard options offered to women fall drastically short.
Like the over-the-counter moisturizers.
Right. Moisturizers and lubricants, they basically act as a temporary Band-Aid. They might provide surface relief for, a few hours, mainly during sexual activity.
But they don't actually fix anything.
No, they do absolutely nothing to reverse the underlying tissue degradation once they evaporate or get absorbed.
And then there's systemic hormone replacement therapy, or HRT, which, it's effective for some people.
It is, yeah. But a vast number of women either cannot take it due to medical histories, like maybe they've had breast cancer,
or they just simply prefer to avoid systemic hormones altogether. So if you picture a healthy, estrogen-rich labial tissue, it functions a lot like a brand new sponge.
I love that analogy.
Yeah, like it's plump, it naturally holds moisture, and if you compress it, it has this structural bounce that springs right back.
Right. But estrogen-depleted tissue behaves like a sponge that's been left out in the hot sun for a week.
Oh, wow.
It just becomes thin, dry, and super brittle.
So let me ask you this. Are we just dealing with a surface-level moisture deficit here? Or is the actual cellular scaffolding of the tissue breaking down?
It is fundamentally a structural breakdown of that scaffolding. We're observing the physical loss of collagen, the fragmentation of elastin fibers,
Right.
and this severe depletion of naturally occurring hyaluronic acid within the extracellular matrix.
Which makes the sun-dried sponge comparison even more accurate, right?
Exactly, because you cannot just splash surface water onto a degraded, brittle sponge and expect it to fix the internal micro tears.
You actually have to rebuild the fibrous network of the sponge itself.
Precisely. And that structural deficit is what creates the absolute necessity for regenerative medicine.
Right, because since lubricants are basically just temporary water on a broken sponge, treatments really have to focus on rebuilding the tissue from the inside out.
Yes.
And here's where it gets really interesting. Enter polynucleotides.
Yes, this is where the science gets wild.
To define them simply, they are highly purified DNA fragments. But the origin of these fragments is, well, it's startling.
Startling is a good word for it.
The data specifies that these polynucleotides are derived from the gonads, specifically the sperm of salmon or trout.
Yep, correct sperm.
How does the human body not immediately mount a massive immune attack against fish DNA injected into such a highly sensitive area?
I mean, the reaction to the origin source is always shock, understandably. But the secret lies entirely in the manufacturing and purification process.
Okay, so how do they clean it?
Well, to prevent an allergic disaster, laboratories utilize these very intense high-heat ultrafiltration techniques.
Interesting.
Right, and this rigorous extraction completely cleaves away the protein casings, the peptides, and all the cellular debris that would normally trigger an immune response.
Ah, so the process strips the biological material down to just its barest molecular components.
Exactly. What remains are just pure nucleotides, and these are the fundamental universal building blocks of DNA.
Like adenine, guanine, cytosine, and the thyme.
Yes, exactly those. And because the chemical structure of DNA is universal across nearly all living species, your immune system doesn't examine a purified nucleotide and flag it as a foreign fish cell.
It just sees it as raw material.
Exactly. The human body happily accepts these basic building blocks to fuel its own cellular repair processes.
Okay, but once these raw materials are actually injected into the labia, they have to do more than just take up space, right?
Right. They aren't just sitting there.
Because traditional dermal fillers, like those hyaluronic acid fillers used in facial aesthetics, they primarily just occupy physical space to inflate the tissue.
Yeah, they just puff it up.
So how does the mechanism of action for a polynucleotide actually differ from that?
So, polynucleotides act as potent biostimulators. Rather than just sitting in the tissue as a passive filler, they actively communicate with your cells.
Like they communicate.
Yeah. When they're injected into the dermis, they bind to specific receptors on fibroblast cells.
And fibroblasts are essentially the biological engines responsible for maintaining the structural framework of human tissue, right?
Exactly. They are the factory workers.
They are the cells that manufacture collagen.
They manufacture collagen, elastin, and glycoproteins. But in an estrogen-depleted environment, these fibroblasts become really sluggish and dormant.
Like they've gone to sleep because the estrogen signal is gone.
Right. So the polynucleotides essentially wake them up. They provide both the raw material and the chemical signal to start producing brand new type 1 and type 2 collagen.
And fresh elastin fibers too, I assume.
Yep. But the regenerative cascade actually goes even deeper than that. Polynucleotides also trigger the release of vascular endothelial growth factor, or VEGF.
Which promotes angiogenesis.
You got it. And angiogenesis is the creation of new microblood vessels.
Right, so by sprouting new capillaries, you essentially restore vital blood flow.
Exactly, which brings oxygen and essential nutrients back to that starved vulvovaginal tissue. And finally, these polynucleotide fragments physically reorganize themselves within the tissues to form a three-dimensional gel matrix.
A gel matrix, what does that do?
This intricate matrix acts as a really powerful moisture magnet. It traps water molecules and hydrates the extracellular matrix from deep within.
So, you're restoring the blood supply, commanding the dermate fibroblasts to weave new collagen scaffolding, and laying down a deep, permanent moisture net.
That's the trifecta.
Yeah, that perfectly moves us from theoretical biology to practical application. Let's look at the Palmieri exploratory cohort study from Italy.
Yes, the Palmieri study is fantastic.
They tracked 19 postmenopausal women to see if this comprehensive rebuild actually works in a real clinical setting.
And it's highly illuminating because it utilizes this very specific two-step protocol known as prime and consolidate.
Right, so it tackles the tissue degradation in distinct phases. Step 1 is the priming phase.
Exactly. The priming phase involves 3 distinct treatment sessions, and they're spaced a few weeks apart. The clinician injects a highly concentrated dose of polynucleotides directly into the superficial lamina propria.
And just to clarify for you listening, that is the layer of connective tissue just beneath the surface epithelium of both the labia majora and the labia minora.
Exactly. So this initial stage is entirely focused on waking up those dormant fibroblasts and getting that angiogenesis process started.
Then, step 2 is consolidation. The study outlines that after those 3 priming sessions, the patients received 2 consolidation sessions.
Right.
But instead of polynucleotides, the clinicians injected non-cross-linked hyaluronic acid, or HA.
Yes, a crucial switch.
The sources also mention clinic protocols using products like Nugen, which actually combine both the polynucleotides and the hyaluronic acid into a single syringe.
Along with an ingredient called mannitol, yeah.
Right, so why are we introducing hyaluronic acid and mannitol into what is supposed to be a polynucleotide treatment?
Well, the combination relies on this really profound chemical synergy. The polynucleotides spend weeks building the structural foundation, the new collagen in the blood vessels.
Okay, that makes sense.
Then the hyaluronic acid is introduced to just flood that brand new foundation with deep hydration.
And the non-cross-linked nature of the HA is vital here, isn't it?
Very much so. Because unlike stiff facial fillers that are cross-linked, so they hold a rigid shape.
Right, like cheekbone fillers.
Yeah, exactly. Non-cross-linked HA acts much more like a viscous hydrating fluid that can spread evenly through the tissue.
Okay. And the mannitol acts as sort of a chemical bodyguard, right?
It's a brilliant addition, honestly, because the human body naturally produces enzymes called hyaluronidases, and they constantly break down hyaluronic acid.
Just naturally?
Yeah, naturally. And this breakdown is accelerated by free radicals in the tissue, but mannitol is a potent antioxidant.
So it scavenges and neutralizes those free radicals.
Exactly. It essentially shields the hyaluronic acid from enzymatic degradation. This ensures the hydrating effects of the HA just last significantly longer in the tissue.
Okay, so let's examine the actual results of the Palmieri study at the 90-day mark. The data is just staggering.
It really is.
For these postmenopausal women, disparity of that painful intercourse and overall vaginal dryness fell by roughly 59%.
Wow.
And itching dropped by an incredible 76.3%, and overall soreness and tingling dropped by 70.1%.
I mean, beyond just the symptom relief, the patients actually reported a qualitative physical restoration of labial volume and elasticity.
That's huge.
Those statistics represent massive life-altering improvements for these women. I mean, a 76% drop in chronic itching and a near 60% drop in painful intercourse.
It's basically giving them their lives back.
Yeah, it essentially reverses the most debilitating symptoms of genitourinary syndrome of menopause, giving these women their bodily autonomy and comfort back.
Now, I do want to bring something up because the study methodology does have a pretty glaring confounding factor.
Yeah. Yes, the topicals.
Right. The authors explicitly state that some of these women were also using topical polynucleotide creams or vaginal pessaries at home during the 90-day trial.
Right, they were.
So how do we know the intradermal injections actually fixed the tissue laxity and dryness rather than just, the daily soothing cream they were rubbing on the surface?
What's fascinating here is how the biology of human skin actually answers that critique naturally.
Oh, really?
Yeah. While an exploratory cohort study inherently has limitations, and the authors totally acknowledge the use of topicals, we have to consider the physical limitations of a cream.
Okay.
A topical ointment undoubtedly provides a complementary surface-level soothing effect. But creams physically cannot penetrate deep enough through the epithelial barrier into the lamina propria to stimulate something like angiogenesis.
Right, so you cannot just rub a cream on the exterior paint of a house and expect it to rebuild the rotting wooden framing inside the walls.
That is exactly it. The physiological changes documented in the study, like the long-lasting elasticity, the creation of new capillary networks, the physical volumization.
Right, the real structural stuff.
Right. That only occurs when fibroblasts deep within the extracellular matrix are mechanically stimulated.
So the surface creams provided symptomatic relief, but the profound structural reversal really heavily points to the efficacy of the injections.
Absolutely. Though the study authors do concede that larger, completely randomized controlled trials are necessary to isolate the variables perfectly.
Well, having established the profound cellular impact of polynucleotides, we really have to look at the broader landscape of intimate procedures now.
Yes, context is key here.
Because this biostimulating injection is just one option in a booming market.
Yeah.
And understanding the mechanisms and risks of the alternatives really highlights a massive issue regarding patient safety.
It raises a super important question about how we have historically treated intimate tissue laxity in the first place. Because before injectables gained traction, the non-hormonal gold standards were often energy-based devices, specifically CO2 and obium lasers.
And lasers operate on a completely different biological philosophy. They rely on the principle of controlled damage.
Yes, trauma.
These devices deliver intense, targeted heat energy into the vaginal mucosa. They purposefully create thousands of microscopic thermal injuries or, microablations.
Right, and the theory is that the body's natural healing response will just rush in to fix these burn injuries, producing new collagen in the panic to heal.
But it's an aggressive approach, right? Like, it forces regeneration through trauma.
It is. The safety profile is completely different from a biostimulator that simply offers the cells the raw materials to rebuild peacefully.
Because the vulnerability of estrogen-depleted tissue makes thermal trauma incredibly risky, doesn't it?
Oh, absolutely. The sources provided a case study from the NICE-E guidelines that illustrates basically the worst-case scenario.
Yeah, that NICE case report is honestly harrowing.
Yeah.
It detailed a 65-year-old postmenopausal woman who underwent a standard course of laser therapy to treat vaginal dryness.
Right.
And a few weeks after her final session, feeling like her symptoms had improved, she resumed sexual intercourse and immediately experienced severe vaginal lacerations.
Because the tissue was far too fragile to handle the mechanical stress after that thermal injury.
It's terrifying.
And when she presented to doctors months later, the trauma and the subsequent chaotic healing response had resulted in severe vaginal stenosis.
Wow.
Instead of healthy elastic collagen, her body just produced fibrotic scar tissue.
The scarring was so severe, it resulted in a foreshortened vaginal canal measuring only 2.5 centimeters long.
2.5 centimeters is tragic.
She was completely unable to engage in normal intercourse.
It serves as a really stark warning about using thermal destruction in delicate areas. Sometimes the body overreacts to the heat, prioritizing rigid scar tissue over flexible mucosa.
Right. And when you contrast that risk with surgical options like labiaplasty or vaginoplasty, which those require general anesthesia, cutting, suturing, and weeks of painful downtime.
Yeah, suddenly the appeal of a regenerative injection becomes very obvious.
Definitely. And the surge in popularity for these non-surgical intimate injections brings us directly to the regulatory landscape.
It is the Wild West.
Seriously. The UK non-surgical cosmetic industry is currently worth an estimated £3.6 billion, and shockingly, it operates with very little government oversight.
It's quite alarming.
To address the resulting safety concerns, a major government consultation is underway right now, heavily championed by the Joint Council for Cosmetic Practitioners, the JCCP.
Right.
And they are pushing for a strict new licensing scheme.
So the primary goal of this JCCP consultation is to evaluate high-risk procedures and place intimate injectables into a heavily restricted red category.
And under these proposed regulations, a red category procedure could only be legally performed in premises registered with the Care Quality Commission, or CQC.
Right, which is a huge step up in safety.
But more importantly, it mandates that only appropriately qualified medical professionals, so doctors, registered nurses, or dentists, could actually administer the injections.
Exactly. It would completely ban lay practitioners or, high street beauty therapists from performing intimate regenerative treatments.
So if we connect this to the bigger picture, it highlights a critical reality for you as the consumer.
Patient safety currently hinges entirely on a patient's ability to vet their practitioner.
Right.
A product like Nugen, utilizing the science of polynucleotides, is incredibly safe and effective, but only when injected into the precise anatomical plane.
Because the clinician has to accurately target the superficial lamina propria, all while navigating an incredibly complex vascular network.
Exactly. Injecting into the nerve-dense tissue of the vulva requires a profound understanding of female pelvic anatomy.
You definitely cannot walk into an unregulated cosmetic clinic and just assume the practitioner holding the syringe understands the intricate pathology of vulvovaginal atrophy.
No, you really can't. If you're looking to explore these treatments, you must seek out qualified medical professionals, gynecologists, specialized aesthetic doctors, or advanced nurse practitioners who have documented training in intimate regenerative medicine.
So what does this all mean? Let's quickly summarize the ground we have covered today.
We started by examining the harsh biological reality of intimate aging.
Right, that postmenopausal plunge in estrogen fundamentally degrades the structural scaffolding of the vulvovaginal tissue.
Which leads to severe laxity, dryness, and a massive decline in quality of life.
And then we explored how intimate polynucleotides actually provide a structural solution.
These highly purified, non-allergenic DNA fragments derived from trout act as powerful cellular communicators.
Right, they instruct dormant fibroblasts to rebuild collagen and elastin while simultaneously triggering the growth of new blood vessels.
And when this DNA scaffolding is synergistically combined with hyaluronic acid and mannitol, well, the clinical data reveals a dramatic reduction in symptoms like painful intercourse and chronic itching.
It essentially offers a scientifically grounded, non-surgical, and non-hormonal path to actual tissue regeneration.
We also contextualize this breakthrough within a largely unregulated market, emphasizing the severe risks associated with thermal lasers.
Right, and the absolute necessity of choosing highly qualified medical professionals for any intimate procedures. Because understanding the exact mechanics of purified fish DNA matters to you, because it demonstrates how rapidly regenerative science is evolving.
Exactly. Understanding the biology of your own body empowers you to make informed choices and, frankly, demand better medical care.
Most importantly, having these open scientific discussions shatters the taboo of intimate aging. You do not have to accept suffering in silence simply because society feels uncomfortable talking about vulvovaginal health.
Knowledge completely dismantles that taboo, allowing patients to seek out therapies that genuinely restore their comfort and confidence.
I want to leave you with a final mind-expanding thought to ponder on your own. We began this deep dive discussing how aging is usually viewed through the lens of a mirror, treating superficial wrinkles or volume loss.
Right.
But we've just dissected how purified fish DNA can effectively turn back the clock on severe structural tissue degradation in the most delicate region of the body. It's literally commanding the cells to weave new scaffolding from the inside out.
It's incredible.
So if this biostimulating technology is already this effective at reversing severe atrophy without cutting or burning the tissue, could it eventually advance enough to replace all invasive cosmetic surgeries? Are we looking at a rapidly approaching future where our ability to communicate directly with our cellular machinery renders the surgical scalpel completely obsolete across the entire human body? Think about that. Thanks for joining us on this deep dive.